This is a bag valve mask, which is often abbreviated to BVM. It consists of a face mask with an expiratory valve, a reservoir bag, a self-inflating bag, and an oxygen inlet and tubing. The BVM is used to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. This artificial ventilation is the most basic yet essential skill in airway management and should be started as soon as possible. Here's how it's used. If oxygen is available, add it via the oxygen tubing at a flow rate of 15 litres per minute. The reservoir bag will inflate. Place the patient supine with the head in a sniffing position. Then apply the mask to the patient's face, ensuring the nose and mouth are clearly visible through the plastic. Using your thumb and index fingers, create a C shape on both sides of the mask, making sure to apply gentle downwards pressure evenly on both sides. Lift the jaw into the mask with your remaining fingers by exerting pressure behind the angles of the patient's jaw, ensuring a tight seal between the mask and the patient's face. Ask your assistant to ventilate the patient by gently squeezing the self-inflating bag. Aim for an inspiratory time of approximately 1 second, giving enough volume to produce a visible rise of the chest wall. Try to avoid rapid or forceful ventilations. You should aim to support ventilations to 10 breaths per minute in patients not breathing adequately and provide 2 breaths for every 30 chest compressions for patients in cardiac arrest.